Jacqueline.
Nice to meet you. Tell me what brings you in today.
Well, I was referred here by my primary doctor. I got a checkup today from the gynecologist, and when she did the assessment, I told her I had a drink or two a day, and she felt like there was an issue with that, but I don't really see much of an issue because when they did all the tests, my baby was completely healthy.
Okay.
I'm 4 months and I'm on a normal trending pregnancy right now, so I just came because they told me I had to come.
Okay. Okay, I understand that. Let's take a look into it just a little bit, though, okay? You mind if I ask you a couple questions?
Go ahead.
Okay, so what is your drink of choice?
I like tequila.
Okay.
Lately, I haven't been able to drink tequila, though. It's been making the baby a little upset, so I've been having to drink wine instead. The baby seems to like wine a lot.
Okay. Now, have you ever heard of fetal alcohol syndrome?
No.
Okay, so with fetal alcohol syndrome, and this is kind of why they kind of emphasize the importance on kind of refraining from drinking during the pregnancy stages. Fetal alcohol syndrome is a syndrome that occurs when alcohol actively passes through not just the parent's bloodstream, but through the unborn child's bloodstream. So it can lead to abnormally low levels of IQ, birth defects, and other symptoms that can be devastating along the line. So I think that may be one of the reasons why they may have referred you. They may have been concerned. How do you feel about that?
I could understand that for someone who may be getting to receive healthy test results.
Right.
Again, my tests were all negative. Like, my baby's completely fine. So, I mean, I'm just doing this because I have to be here, honestly. I don't really want to be here. I have other things I have to do. But I would never place my child in any type of harm. Like, I love my baby, so.
Right. And I'm 100%, I like that. I like that, you're definitely focused on making sure that your child's health and wellness is of utmost importance, just like you would agree that we are concerned with that as well. My thing is that it is important to keep in mind that, even though the results may have come back clear now, we want to try to, and tell me if I'm wrong about this, we definitely will want to try to prevent it from becoming otherwise down the road.
I mean, I guess you're right.
Right, and that's the thing, like I said a little bit earlier, the thing about fetal alcohol syndrome is that it hasn't necessarily been determined how much alcohol it takes to lead to a child falling into that criteria in which they end up suffering from fetal alcohol syndrome. But what we do know is that continued usage of alcohol can increase the risk of a child ending up with suffering from that syndrome. So that is definitely a major concern. I think that might be something that would be important to you as well, because I'm just going off of what you were saying. Kind of the vibe that I got was that you were looking to make sure that your child ends up being healthy.
Correct. That's my main goal, is that my child is healthy. I would never again harm my baby, so.
It kind of seems like we're at an impasse here, because I 100% agree. I believe you wouldn't want to harm your child, and, I don't think that it's definitely purposeful, but it's kind of like we're at this crossroad where, now we know that alcohol at any level of consumption can damage the health of your child, and we want to avoid that. So what are some things that you think we can do to avoid alcohol usage and maybe find other ways to decompress?
I mean, maybe I can stop with maybe having a drink or two a day.
Okay. And, I know that can be a little bit of a challenge because, like many people, days can be stressful. And, we all want to find a way to decompress. So what I have is a pamphlet with a list of all of the local alcohol anonymous groups in the area. Here's one on Joseph E. Lowry Boulevard. Are you living close to this one?
Kind of, yeah.
Okay, well, there's a list of all of them, throughout Metro Atlanta. So whichever one may be best for you, you may want to just check it out and see what they have to say. Maybe they can assist you.
As long as it's gonna be helpful. Do you think they'll judge me as a baby?
No. It's a non-judgmental environment, and everyone there has their own things that they're kind of just trying to work through, and they're trying to avoid alcohol, kind of like what you're trying to do. It may not be that they're all pregnant, but they're all trying to avoid alcohol for different reasons. And also, here's a list of different coping skills and strategies that you can use, just to kind of decompress at the end of the day that may be healthy alternatives. Maybe you might see some on there that you already do that you may not do as frequently.
Alright.
Alright. Well, do you have any other questions for me?
No, but I do thank you. I'm gonna try to work on that.
No problem. I'm sorry about that.
No worries.
Thanks. You have a great day, okay?
Thank you, Daniel. I'll be in touch.
Alright, see you later.
Bye.
Hey, good afternoon, Daniel.
Hey, how'd you know my name?
I have a schedule here full of names,
Right.
so that's one of the things I'm here for.
Okay.
Keep myself on track and make sure all my clients are addressed properly.
Okay.
I am Dr. Johnson,
Hi, Dr. Johnson.
so I will kind of be working with you today just to try to see where you're at currently, as far as with your goals and everything, kind of assess, how you like to move forward within this program. We do welcome you, and we're glad to see you here. So let's start off by telling me what led you here.
My dad.
Dad.
My dad wants me to find a psychiatrist because he says that I'm crazy when I'm off my meds, but I feel like I have superpowers when I don't take my meds. So I don't know what he's talking about. Like, I just feel like I'm not as creative when I take my meds.
Okay, Daniel, so a couple things. I just want to rewind just a little bit.
Yeah.
Hopefully me taking notes isn't going to be an issue, is it?
No, not at all.
Okay, perfect. Secondly, I know you mentioned your dad wants you here because he thinks you're crazy when you're off your meds.
Well,
Is that correct?
yesterday, I guess there's a little bit more to the story. So yesterday, this is what he says happened, okay? So we were at Walmart and I went outside yelling that my pants are on fire. Apparently I was naked and I was screaming that there were ants all over me. And I don't recall, but I just got released from the 13th floor at Grady, and now I'm here, and now he's talking about I need to see a psychiatrist and get meds.
Okay, so thank you for sharing that with me, Daniel. I know it may not be the best to recall moments like that you may not be as proud of, but that was very bold of you to kind of do that for me, so thank you a
I
lot.
thought it was awesome.
Well, I'm glad you could also
When I
think
heard
it was awesome.
So, yeah.
So,
Don't judge me.
a few things, Daniel. Your dad said you're crazy when you're off the meds. So do you mind refreshing me, what meds were you recently taking?
I was taking lithium. And that was really it. And one day, I just felt really just blah. And I could not handle feeling blah. So, I said, forget that stuff. But that's not really what I said. That's what I'm going to say because I want to be professional with you here now.
Well, thank you. I do want to remind you, we do have rules here at the center, and that would be one of them. So I thank you so much for following along with that.
I don't even want to be here, but that's cool.
Some of our patients don't really want to be here, Daniel, and I'll be quite frank, if I was in your position, I probably wouldn't want to be here either.
So why do you have me here?
just because sometimes we do have to come despite whether we want to or not. The bigger picture is if we want to help ourselves overall, we have to do a few things that we may not necessarily like. So this is just one of those things. But we'll say we do try to make it feel as much as home as possible.
Right.
We have a very supportive staff here. One of our goals is to kind of go over, I know you were taking lithium, which is a drug that we have a lot of our clients take.
Okay.
It does have some side effects where sometimes you may feel blah, but it doesn't mean that you stop taking it.
Well, I mean, I'm bipolar, so that's why I'm taking it. But
Were you diagnosed with being bipolar, or how do you know that you're bipolar? What makes you think that?
I went to the 13th floor a while back, and I had been told and prescribed lithium because I had bipolar. This is before the last time I was on the 13th floor, and I don't even talk about what I did then. Just know that it was hilarious. But yeah, so I was prescribed lithium and referred to an outpatient psychiatrist. Then I didn't go. I did get the medications though, and I stopped taking them. You know, but that's not about bipolar though. What's wrong with bipolar though?
Well, there's nothing wrong with bipolar. We would say that, you know, all diagnosis makes you normal. It doesn't make you any different from the next person, but it's how you treat it and how you deal with it.
I feel like
That's a
I'm
determining
perfectly
factor.
fine. I feel like I'm normal, but I also
You
feel
are.
like Kanye, me, right? Me, Kanye.
Okay, Daniel, so what I'm going to do, I understand Kanye. Kanye's a huge celeb right now. A lot of people like him.
Daniel from the Lion's Den. Daniel from Clark, Atlanta. Okay.
I understand that, Daniel.
Okay.
So what I'm going to do is, just based off of some of the things that you've told me and some of the things that I'm picking up
I'm
on now,
amazing. That's what I'm saying.
I'd like to get you scheduled in for one of our clinicians to do more of a detailed and kind of focused assessment with you.
Right.
We're definitely going to get you entered into the center, get you back on those medications as soon as possible. But first, we're going to do this assessment. And once you guys complete the assessment, we'll go over what we discussed.
Right.
And we'll create a plan from there. Does that sound okay?
I mean, I'm willing to go in. I just wanted to say, some people say that I'm grandiose, but I wanted to show you how not grandiose I am. So what I'm gonna do is
Okay.
like how I made those other references, like Jesus, me, okay?
You have a very good liking of yourself, and that's a good thing, Daniel.
Right.
So what we're going to do again is we're going to get you over to the clinician.
Yeah.
Going to get some tests ran. Going to do an assessment. Once
Yeah.
we get that done, we'll call your dad in with you. We'll go over some things, and we'll make the next steps from there. Okay?
You guys have Mountain Dew?
Yes, I can get you a Mountain Dew while you wait. So if you could just follow me, and we'll get you over to that clinician. Okay?
Awesome. Awesome.
Come on, Daniel. Let's see the.
Okay. Walk me around like I'm a child.
I'm not trying to make you feel like a
I feel like
child.
a child right now.
We just want to see the clinician.